Sharma. Please welcome them to the stage. Thank you.
Hi everyone, it's great to be here. I am Abhishek Sharma from Nexus Venture Partners, venture capital firm partnering with exceptional entrepreneurs in the US and India. Speaking of exceptional founders, I'm here with one today, Kris, Gale, co-founder and chief technology officer of Clover Health. Kris, welcome.
Hey, thanks. Good morning.
Morning. Tell us about what's Clover Health and what's the genesis of the company.
Yeah, absolutely. So Clover is trying to fix the healthcare crisis here in the United States by reinventing the role of an insurance company to make it a technology-enabled services organization. They can actually manage the care of our members and improve health outcomes. So we're doing that by collecting a lot of clinical data about each of our members, understanding the clinical state that they're in, understanding the appropriate care that somebody in that clinical state should be receiving over time, so we can actually reason about the economic opportunity that exists in filling care gaps for those people. So for example, if somebody has a particular chronic disease, there are regular follow-ups, there are particular tests that they need to receive on a certain cadence. And we can identify when they're not receiving those things, because as the insurance company, we're paying for those things when they happen. So we'll know when they're not happening. And then we have our own team that we can dispatch to go fill those care gaps, either by reaching out directly to members, by reaching out through the providers that are in our network. So for example, the primary care doctor, a specialist they may be seeing, to try to influence those people to fill those care gaps, because we know they're associated with improving their health outcomes. And that whole operation is driven by technology, so we can actually measure the effectiveness of particular approaches and then optimize those things over time.
Fascinating. A lot of us here in the audience might be wondering, how are we different from an existing health insurance company? Or for that matter, are we even one?
Yeah, that's a great question. So we don't, it's funny, we don't describe ourselves as a health insurance company internally. We see ourselves as sort of fixing the problem that exists in this country with the traditional role of an insurance company, which is just to be this transparent financial instrument for paying bills for people. We think there's a huge opportunity of reinventing that role of the company that collects premiums and bears the risk of future healthcare claims to actually participate in care. And that I think makes us very, very different from a traditional insurance company. The insurance companies here in the United States are spending a lot of time trying to be as thin as possible, to outsource as many services, to have as little overhead as possible, and to do as little in the system as possible. Where we think that there's actually a role to come in and play a very active participatory role with the providers in the network in managing and coordinating care. And I think that really does set us apart. And then on top of that, we've got a really big technology operation and a data science operation that's focused on building the tools and the data insights that allow us to manage health outcomes, which doesn't really exist in the insurance industry.
Data science in healthcare, that rings a bell. How do you see the role of technology evolve and play out in healthcare in general?
Yeah, I think one of the things that's interesting that's been missing from healthcare is companies that are able to, over time, understand what's effective at managing outcomes in a population. So you'll see these big integrated health systems like Kaiser, Geisinger, doing these long-term, multi-year studies where they're trying one particular program, and years later they discover whether that works. And they really only discover, does it work across the whole population? There's a huge opportunity to use technology in the way that say, retail or online shopping or Netflix or Google has used data science to really start to understand and scale personalization, where you can say, yes, this may or may not be effective, but is it effective for this slice of the population? If something's not broadly applicable, it may still be really, really effective for this slice. So being able to make those inferences and understand that in your data sets, and then be able to invest resources in things you can sort of empirically establish are effective.
Fascinating. And how do you see Clover scale from here?
Yeah, so the technology that we're building is really designed to allow us to manage care at scale. So one of the insights we had coming into this business, we have a chief medical officer, and we said that if we were to be able to just give this person a spreadsheet of our first 25 members, he could really manage that population. He's a clinician, he understands what these people need. So the question is, how can you do that efficiently at the scale of eventually serving millions of users? And that's really what the technology allows us to do. It allows us to take those insights that clinicians have and codify them into software-driven workflow and alerts and the management of this population using technology so that you can effectively apply that across millions of people and really ensure that everyone is getting as much as possible of the care they really need to have the best possible health outcome. And ultimately that results in cutting the costs that we bear as the insurance company for complications of chronic diseases or preventable hospitalizations to the point where we're able to operate with a much better financial profile than any of our competition.
Fascinating. So it's, from what you described, it seems like everybody wins in the process, payer, provider, as well as the patient. Is that right?
Yeah, I mean, that's our hope. And right now we're operating as a Medicare Advantage health plan, and Medicare is a federal insurance program. So ultimately, if we can reduce costs under the Medicare program, we're saving taxpayers and the government a significant amount of money too. So yeah, hopefully if we can improve outcomes, we benefit, our members obviously benefit. I mean, that's their health that we're improving. We hope to be able to give providers better data so that they're able to do more of what they signed up to do when they became doctors, to actually work with their patients rather than dealing with sort of the clumsy overhead of submitting claims and being an insurance company. And then, yeah, ultimately the taxpayers as well hopefully win with this.
Absolutely. And how do you see the future for Clover?
The future for Clover is really interesting. So currently we're serving most of New Jersey, most of the population of New Jersey. We will eventually expand outside of the state of New Jersey and hopefully get to nationwide with this plan in the Medicare program. I think there are good opportunities after that to expand into other health insurance markets, so potentially Medicaid or the commercial insurance market. That's sort of long-term thinking. We've got a lot to build out and prove where we're at, but you can see these adjacencies down the road for us, and then who knows after that. There's a lot of opportunities once you have all of these insights about the population that you're serving, to be able to validate different therapies or potentially to partner with companies that are rolling out new therapies and be able to say, look, we've got the platform where we can see if this is effective at managing the health outcomes of this population.
It's very exciting what lies ahead of you and Clover. Thanks so much for making time. Always a pleasure talking to you, Kris.
Yeah, absolutely. Thanks for doing this. Thanks, everybody.